substance abuse can affect anyone at any time. The NHS and a number of charities and groups all aim to provide the resources to support as many people as possible. But with budget cuts hitting every part of the public sector, they are being pushed to breaking point. This documentary sets out to investigate what it's like to live with addiction. We will hear stories of struggle, rehabilitation, and loss as we try to answer the question, is there enough education about substance abuse?
This is most of my evening, watching telly with these two.
Frazer was a nurse living in central London. Now he's a recovering alcoholic. His drinking got increasingly worse following the split from his husband, and 2 years ago, Frazer was involved in a drink-driving car accident. It was then he decided it was time for change, and received the help that he needed through a charity called Turning Point.
The worst bit of the whole thing was actually going in for that initial assessment, because, you know, as you're walking up to the building, you imagine everybody's staring at you. Oh, look, there's the druggie, which obviously they're not, but in your head, and then you go in and you think, oh my God, they're going to judge me and think I'm such a shit person. I was drink driving. Oh my God, that's like the worst thing you can do. And you feel so much remorse for what you've done, but also then and a lot of shame. And I think a lot of it is about going for the right reason. I initially went there to shut my mother up from moaning at me, which I think is why I didn't have my home detox for so long, because they could tell I wasn't ready. But the staff there were brilliant at making you feel at ease. And you go in and you say, oh, well, you know, I failed at everything. And they'd say, well, no, you haven't. You've just got some issues at the moment that you need to deal with. And the way they put you at ease straight away. And it was such an eye-opener being in a room with all these people who are alcoholics, cocaine addicts, heroin addicts, and actually seeing it's not the stereotypical, oh, well, I can't be an alcoholic because I don't drink out of a brown bag on the bench in the middle of town. And actually seeing these people who hold down full-time jobs and, you know, they're injecting heroin 2-3 times a day and they still are functioning addicts. So it was a real eye-opener to see that. And it's being around like-minded people, whatever their addiction, but people who suffer from addiction, it helps you to understand yourself a bit more. And also, the actual detox week wasn't as bad as I'd expect, because they told me every single possible thing that can go wrong, and fortunately none of them did. It was nowhere near as bad as what I built it up to be, which is good, because then you start feeling that relief very early, because you haven't dropped dead on the first day. So I went on to be a peer mentor, which is a volunteer of somebody who's been through the service. And now I'm staff there, and the number of people that come in and they're like, I remember you were a peer mentor. Oh my God, you're such an inspiration. This is what I want for me. I want to be able to do it. It's really nice to be able to give that back and see that I am having some effect. My negative experience has been a positive effect for some other people's, which is really good.
As I was saying, double your discount on all new matches.
Right, yes, we'll have you in here with us. She's less likely to bark at things if she's in here with us. If she's a pain, then I'll take her out.
The day after my 11th birthday, I saw firsthand how devastating the effects of substance abuse can be when my auntie passed away. She had been a heroin addict since she was 20. Inspired by the work of charities that helped her sister, my mum became a drug and alcohol support worker. As the 10-year anniversary of my auntie's death approaches, I spoke to my mum about the impact her addiction had on our family.
Hayley had a baby stillborn, and for me, that was horrific. Her addiction had meant that her son had been removed from her care several times for a few hours or a few days, and he'd stayed within the family mostly. And I think, interestingly, she got pregnant and the baby wasn't made a ward of court. There was no kind of court order on it. So to all intents and purposes, she was going to be keeping this baby. She was supposed to be going to Glastonbury for the weekend. She was about 7 months pregnant and had been using methadone and alcohol, and certainly a little bit of heroin, I think, throughout the pregnancy. And the baby was stillborn. On the weekend, she should have gone to Glastonbury. She didn't feel too well, so she stayed behind. Aaron, my nephew, called me and said that Mummy was in the toilet and she was crying and there was a lot of blood. And I raced down there and I arrived just as the ambulance men did. And I think probably one of the most significant things that hit me at that point was how obnoxious the ambulance crew were to her, actually. And while I accept that they'd gone into a place where there was evident drug use and it wasn't very clean and, you know, all the other stuff that goes on in that world, she was still a human being going through quite a significant trauma. And I felt that she wasn't dealt with entirely appropriately. And then, of course, the grieving of that and the funeral that went on afterwards, you know, with this tiny weeny little coffin. It was pretty horrific, really. And absolutely was part and parcel of her accelerated drug use afterwards.
Did she ever confide in you that perhaps she wanted to get clean?
For a long time, I don't think there was an acceptance that she had an addiction, you know. I think she for many years wouldn't accept it, would talk about other people's addictions and not about her own. Then when Aaron got older and his partner had a baby, a little girl, and it was an opportunity for her to be a grandmother, things did certainly, there was winds of change then. There was a definite turn in attitude and a feeling really that she just about had enough. I mean, over the years, you know, I couldn't pinpoint significant things, but she'd been beaten up several times. She'd had her house set fire to. She'd had all sorts of things happen to her. She'd been quite seriously beaten up. She'd had manic episodes where she would smash her face against the wall. You know, all sorts of very disturbing things that went on throughout her addiction. And I think probably there was a point when she just didn't want it anymore. Most recent to her change was that she'd owed a dealer some money. They came to the house and they attacked her dog. And I think that point was massive for her. That dog was loyal and she adored it. And when somebody hurt her dog, it was a real turning point for her. And I guess maybe she was more ready then.
When did she pass and what were the circumstances of that?
She was on a prescription of methadone in terms of starting a reduction programme. Her body had been used to a massive dose of heroin and methadone each day, and her reduction plan, she decided, wasn't going fast enough for her, so she'd started to reduce it significantly more. On this particular weekend, she'd attempted to go a day without the methadone. Her body couldn't cope with it. She had a massive heart attack and died. My nephew came home and found his mum dead. I had to speak to our parents about it, which was incredibly challenging. And in a sense, I guess I didn't have an opportunity at that point to start my grief because I was so concerned about my parents and how traumatised they were. And then within a few hours, the headline of the local paper was "Addict Found Dead." It was just very derogatory. It was in all 4 or 5 of the local papers. It was on the news. It was just horrid. My father started shopping in the next county. He would travel an hour or 2 to go shopping rather than walk into the town that we lived in. People putting on Facebook that they'd seen her when evidently they hadn't because she was dead. It was a horrific time, a horrific time for all of us.
According to the NHS, an estimated 2 million people are fighting an addiction in the UK. Dawn Holmes is a manager of the Somerset Drug and Alcohol Service Young People's Team and has been in the industry since she graduated university. She says that there is simply not enough education about the impacts of addiction.
Prevention is much better than dealing with the consequence further on. It used to be that drug services would go into schools and provide a lot more education. That doesn't exist anymore. I think it would be really good to use peer mentors, for example, to go in and actually talk about the reality of what substance misuse does and where it leads. And it is difficult to get that balance. You can't just tell a child drugs are bad and they're going to kill you, because what happens is they go out and they smoke them or take them and they go, I'm not dead, that didn't happen. And then they don't believe anything anyone says to them. So I think harm reduction is the way to go and education is the way to go. Getting into the schools and really giving some honest education about what it does to you, where it leads, not just the legal and physical impact on you. I think it's really important to have a good, supportive and complete package offered within schools. And I don't think it's enough at the moment. I don't think the schools have the skills to provide it themselves. And there's not the funding out there to get the experts to do it. Addiction services don't have the capacity and the funding to provide it. So I think it is really lacking, and I think it would make a real difference if we got that bit right, rather than dealing with it once it's all gone wrong.
Nearly 24,000 children under the age of 18 were receiving treatment for a substance abuse problem during 2007 and 2008. This number is thankfully decreasing. But the problem is not just with young people. In February 2017, a report on substance misuse in an ageing population was published. It found that in Wales, the only group where referrals to treatment services were increasing is in those aged 50 plus. So I'm going to Cardiff Bay to meet with Welsh Assembly member and GP Dr Di Lloyd to ask him the crucial question: could a more honest education about addiction save people's lives?
It should save lives, yes, because, like I said, some people still think that various drugs are harmless. No, there's no drug that's harmless. Believe me, there's no drug that is harmless. Lots of people think, yeah, you can use any drug on the weekends and be perfectly okay during the week. No, not really. We have colossal levels of low-level anxiety and depression in our community, especially amongst young people. And we always wonder, why is that then? You know, you've got all your lives in front of you. You're young, fit and healthy. You look beautiful, fantastic. Yet you're coming to see your GP all the time because you're depressed. When we ask the question, do you use any recreational drugs? And the answer is always yes. So there's nothing that is without harm. And yes, substance misuse services and their sort of overlap into mental health services, they are Cinderella services because in the eyes of the general public, despite the fact that both mental health and substance misuse are pretty common, people are in a state of denial about it, and certainly there's a stigma attached to both. And that stigma is translated into people not wanting to vote for measures that means increased spending. The more connected we are electronically, the less connected we are face to face, and we've lost that empathy and warmth for fellow human beings, and that's what people, when their lives are absolutely desperately horrible, they need that. They don't need a helpline millions of miles away. They need to talk to somebody who knows something about it and is willing to see them over and over again.
Mickey and Frazer both agree that although the NHS and Turning Point do everything they can to help people with addiction, if the education was available, the pressure on services like these could be less.
It is all about education. There's no education for them to know alcohol's a bitch because it's everywhere. You know, every soap opera is based around a pub, so it's something that's drummed into you. Drinking's fine, but it's not. There is the side effects of drinking. And just saying, well, they're illegal drugs, you stay away from them, that isn't going to work. Because the kids are going, well, why is it illegal? What does it do to you? And they're going to want to know. And I think part of education should not necessarily be, no, you shouldn't take them, they're bad. It should be, right, well, this is this drug. What it does to you is ABC. So when you take Coke, you're going to get a really good high. You're going to feel great. But then the next day, you're going to feel like shit and want to kill yourself. Because the dealer's not going to tell you what a downer you're going to have from it. So there's never both sides of the coin explained. So all the people hear about is, oh yeah, have this, you get a really good buzz from it, to get them to take it. And then you don't hear about the downer. So then when you're coming down the next day, it's like, I want to feel like that again. I want to take some more.
Our society does not accept drug use. It accepts it in celebrities, but not in everyday people. So my suggestion is that we're more proactive than reactive. It would be much more cost effective to work with these young people, giving them the essential skills and the resilience to manage the situation they're in, rather than later on when they're taking drugs, drinking and costing society, the NHS, etc., loads of money. And so I think, no, I don't think there is enough education. I don't think there's enough money thrown at it. I don't think teachers are aware enough of it. I think there's still a massive taboo about drugs and talking about them. Yeah, I think there is a lot of work to be done.
Addiction has been a turning point for all of these people, but the problem is only getting worse. Over 3,500 people died from drug-related causes in 2015, and thousands of families were left without a loved one.
She was always fun, incredibly good fun, but her addiction took over. I mean, previous to that, she was a mischievous little thing when she was little. And hilarious, and way cleverer than me at school. So she could have gone quite a long way. A waste of a life, I guess you could say.
The need for more education about substance misuse is bigger than ever to help turn people's lives around before it's too late.
I think back to what I did then and the things I did horrify me because that's not who I am. Sometimes I'm really, really disgusted with myself sort of that, well, why did I let myself get like that? Well, I didn't wake up one morning and think, oh, I'm going to be an alcoholic. It's not something you choose to do, it just happens.
There can be many more success stories if we work to have a system that focuses on prevention rather than dealing with consequences. The time for change is now.
And at the time I thought, yeah, my life was fine. It's only now that I look back on it I think, Christ, I wasted so many opportunities for different things. To what? Sit at home and drink on my own? I thought my life was sorted and I was fine. And actually look back and think, God, I must have been a joke to everybody.